Well, on this edition of MSU Today, urology is the topic. And we'll do that with two DOs from the MSU Healthcare Urology Clinic. That would be Todd Moyerbrailean and Arya Khatiwoda. That's great to have you both on the show. Welcome.
Thank you.
Thank you.
Can I start by telling us what is urology?
Well, I can start. So urology is a subspecialty. It's actually a surgical subspecialty that really focuses on the genitourinary systems and disorders of the genitourinary system. So big words, but essentially how you pee, how your kidneys work, your bladder, prostate in men, some urethral and vaginal disorders in women. And there's a variety of subspecialties even within the surgical specialty, of which one of them is what Dr. Moyerbrailean does.
My subspecialty is urogynecology, and it's a blend of both urology and gynecology. Matter of fact, that's where I got its start. The two boards got together and said, we want to make a discipline that just focuses on female pelvic floor disorders. So in addition to problems with the bladder and the urethra, like Dr. Khatiwoda talked about, we also deal mostly with pelvic floor issues, which is prolapse, uterine prolapse, bladder prolapse, that kind of thing.
And you started to answer it, Todd, but tell me, each of you, where you specialize in urology.
So I'm a general adult urologist, so I see men and women. And, general urology is kind of all the bread and butter thing. So kidney stones are a big part of it. Urinary disorders, or what we call voiding dysfunction, is a part of it. Incontinence in women or leakage of urine is a big part of it. So from a urology standpoint, I do kind of the general day-to-day urology.
And talk a little bit about the practice philosophy you have.
Well, I actually add an extra dimension to the urology clinic and focusing mostly on women and expand more into pelvic floor issues, problems with prolapse and actual bowel problems as well. So it's more of an expanding nature that actually helps urology and dealing with those certain disorders that are specific to the urogenital system.
Urology, at least in layman's terms, when people hear it, they think, men's health, men's issues. So it's very nice to have someone that's very female focused. I think it brings a certain element to our practice that you don't always think about when you hear the word urology. In terms of, practice philosophy, I think for me, It's really about providing something to the community that many may not even realize is available. So urology is a pretty personal subspecialty, I guess. You're dealing with a lot of things that people, women, men, everyone is not always very forthcoming about. So, obviously, as MSU Urology, we're here to provide excellent care to the community, provide urologic care that's at the top of the technological forefront. But for me personally, it's just about building relationships with people and helping people open up about something that's quite personal that they may be embarrassed to talk about otherwise.
And we have an office that really is designed that way. So it's a safe place to bring your concerns to the table, and that's what we do. That's what we specialize in.
So we've sort of touched on it, but who should seek you out? I mean, what symptoms would someone experience that would lead them to seek out a urologist?
So I'll talk about just the general urology side of things, since that's what I see, and I'll leave the more, female stuff for Dr. Moyerbrailean to talk about. But in general, men or women that have urinary issues, that's kind of the basic, I guess, patient that we see is, are you peeing too much? Are you peeing not enough? Are you leaking when you shouldn't be? Are you not able to empty when you should be? On top of that, anyone that sees blood in the urine, anyone with history of kidney stones, think they have kidney stones, think that they have infections more frequently than they should. And then, of course, things that they may not be able to know, but that their primary doctor would figure out, like, is there a growth somewhere in one of the genitourinary organs, the kidneys, the bladder, the penis, the urethra. I guess that'd be the main brunt of the patients that we see.
Yes. And Todd, your specialty?
And obviously, I don't treat men, being gynecologic. My training was based in obstetrics and gynecology and branched out into urogynecology. But we also do similar treatments with women, especially women with overactive bladder. That's probably one of the biggest things we see. And one of the areas that women tend not to want to come in to see the doctor about or embarrassed to talk about. But it is so common. Up to 80% of women by the age of 80 have got this overactive bladder. They just feel like they have to go all the time. And a lot of times their friends are telling them that there's just nothing you can do about it when that's wrong. There are plenty of things that can be done that can actually help alleviate some of those symptoms. Where I differ from my urologic counterparts is I deal a lot more with pelvic floor problems, mostly the prolapse issues. Some would say it's a result of having childbirth, with the damage to the tissues inside the pelvis that creates things like uterine prolapse and pelvic pressure. And most women are afraid to actually come in and have that treated, figuring that surgery is the only thing that can be done. When that's not accurate either. That's one of the big myths in this field, and there are things you can do that actually help alleviate those symptoms.
I'm talking with MSU healthcare urologist Todd Moyerbrailean and Arya Khatiwoda on MSU Today. Tell me a little bit more about how you treat urologic disease then, or are there a plethora of ways depending on what the illness is?
So urology is unique in that while it's a surgical subspecialty, we actually do a lot of non-surgical treatments. And I'd say pretty much for the majority of the benign disorders, so obviously not cancer, but non-cancerous disorders that we see patients for, the first step is very basic, and it's usually behavioral therapy. Mm-hmm. So in terms of treatments, we can do just changes to our day-to-day, looking at our environment. There's medications, obviously, and then typically the last step tends to be surgery. There's surgical treatments for, I would say, almost every disorder that a patient might come to see us for. But we tend to start very basic and then move up from there.
So most illnesses can be treated then.
And even if even if ultimately you end up requiring surgery, we'd start with just changing things about you, about your day-to-day. And I would say that the majority of illnesses can be treated with either one or a combination of the types of treatments that we have.
Yes.
Yeah, I agree. I think the surgical specialties sometimes get the bias that that's all you really want to do is surgery, when really the majority of the time we're not doing surgery. We're actually treating the person first and finding out what exactly they need, what are their goals. We actually figure that out at the very first visit, where they are in their care and what they want. And so we move on in that. We give them the options and let them choose.
Are there particular challenges in treating urologic diseases?
For me, I would say there's patients sometimes come into it with an expectation that we can't always meet. So let's say, you have someone that has had a problem for 20 years and they, finally have the ability to come and see a urologist. We do get some patients that expect immediate and 100% change. It's almost impossible to take a problem that's been there for 20 years and fix it in 20 minutes. But the nice thing is, you don't see a urologist once and are done for the rest of your life. It's a lifelong relationship usually with your urologist, and there really is a certain trial and error that comes with a lot of the benign urology issues, where you try something and if it doesn't work, then we reevaluate you in the clinic, and then we try something else, and ultimately look for a goal that improves your quality of life. You may never be how you were when you were 18 or 20, but we can certainly get you to a point that you're more comfortable and you're happier with your symptoms than you were when you came in.
Yeah, you're treating on a bother most type of a system, where we go after what bothers you the most and try to help you in that respect. Some things we can't cure, and we are trying, and the research is always coming out. We're talking about new things at all times, but that's really where our challenge is some of our disorders are not curable, but they are certainly treatable, and we've got a lot of treatments to offer.
Well, you led me into my next question beautifully, Todd. I was going to ask, is there some exciting research or treatments either coming in now or on the horizon that have you excited about treating urologic disease?
I feel like there's always something new, and that's, we really are living in an exciting time of medicine where there is always something new, and from a general urology standpoint, looking for cancers, with looking for especially prostate cancer in men, we have really changed the game. First, it used to just be a doctor feels your prostate, and if there's something abnormal, then we do a biopsy. Then it was PSA, a lab test. Now we've gotten to a point where we can do MRIs of the prostate and really pinpoint specific areas that need to be biopsied. Even since I graduated residency in 2018, this is a huge shift in how we look at men and men's health and prostate cancer. Seems like there's always something new every day, and it's a very exciting time to be a urologist.
The marvels of modern medicine, right?
Mm-hmm. Well, speaking of, again, my specific focus is pelvic floor disorders, and it's basically weakened tissue in the female pelvis. There's a lot of work being done now in stem cell research, trying to figure out ways to actually improve the tissue quality. If we could actually improve tissue, then we would have a better chance at successfully fixing it or maybe preventing it altogether.
So let me ask, is urologic disease hereditary, environmental, a combination? Can we avoid some or all of it with a healthier life?
Definitely a combination. So there are some things that genetics can be blamed for. Kidney stones are one of those. But at the same time, if you have a genetic predilection, but you also don't drink any water, your risk is way higher than if you're someone that is well hydrated. So a big combination is genetics, but another big combination is your environmental factors and the decisions you make about your health.
Yeah, we go back and forth about that in the research world as far as the pelvic floor and whether or not that's something that's hereditary or not. We're still looking at the answers in that respect. But environment, definitely. Smoking and occupations that are very strenuous are much more likely to have these different disorders. So, yes, you can make a difference by changing your health and lifestyles.
Are there some facts about urology you'd like to reinforce, or some myths you often hear that you'd like to allay, if that's the proper word, or clear up?
Yeah, I have one that really gets my goat. It's anyone that has had a kidney stone that passed it on their own and didn't see a urologist. They always come in and they say, well, I have not had any calcium. I don't drink any milk. I gave up all dairy. But, that is not what to do. It's typically not calcium that's the problem. It's other things in your diet. I mentioned a lack of hydration, so it's usually not drinking enough water, or it's other food components. There are things called oxalates that are found in a variety of foods, even foods we think are healthy that can contribute to stone formation. So the first thing I tell my patients, especially postmenopausal women that seem to get stones, I say, make sure you get the amount of calcium that you need to get, just the normal dietary recommendations, because otherwise you're going to start having trouble with osteoporosis. And you know what? It's probably not going to make your stone risk any better. So that is something that I think people don't have a great understanding of, because you think of stones and everyone thinks, my stones are made of calcium, so I'm going to cut out all calcium. But that's usually not what you need to do to make your situation better.
Interesting. Todd?
I think the biggest myth in my field is more that surgery is the only possible option, and that's not true. As a matter of fact, we probably do non-surgical therapy for 8 out of every 9 patients that come through with some type of a pelvic floor disorder to give them adequate relief. 1 in 5 women, actually, in their lifetime will end up having surgery or some type of a treatment for either urinary incontinence or prolapse of some sort. So that's 20%, very high number.
Well, we've been talking about urology on this edition of MSU Today with 2 DOs from the MSU Healthcare Urology Clinic, Todd Moyerbrailean and Arya Khatiwoda. And let me just ask you each to kind of summarize what you'd like those joining in on our conversation to take away about urology and your practice.
I think the first thing is just knowing that there is a urology practice available here at MSU. It's not, even as a medical student, I hadn't heard of urology until the 3rd year of medical school. So that's a little bit crazy when you think about it. So for just the general population to even know what a urologist is, if a medical student didn't know what it was, I think it'd be pretty surprising. So hey, we're here. Bladder problems, prostate problems, pelvic floor problems, kidney stones. we're here to help. Let your primary care doctor know, and they can get you referred here. And if I could just do another plug for anyone that is in med school listening, I take a lot of pride in being a female urologist. I think now we are seeing more women in urology, but when I was going through med school, it was pretty lacking. So for anyone interested, females, males, whoever, we do have students come and shadow us. So if you're interested, reach out, and we would be more than happy to give you a little glimpse into our day-to-day.
Yeah, come on. I mean, men have been in gynecology forever, so why not? I mean, it should be a blend. You don't want to have one side being heavier than the other. You want to have a nice blend, just like everything else. So, and I think that, to sum up things, if you're concerned, if you've got a problem with bladder, you've got a problem with your bowels, seek out your family doctor and talk to them. If they're not comfortable taking care of you, MSU Urology is here. We can definitely take them on, and that's what we do. We do it day in and day out. It's pretty straightforward for us, and we do everything we can to make the patients comfortable.
Well, thank you both for sharing your expertise with us today on MSU Today.
Thank you.
Thanks, Russ.
That's Dr. Arya Khatiwoda and Dr. Todd Moyerbrailean from the MSU Healthcare Urology Clinic, and much more online at healthcare.msu.edu. And I'm Russ White. This is MSU Today.